Wait for moderator. Okay.
Okay.
Thank you again. Fortunately, this is not one of our shit cases. We just look good because it was someone else's shit case. So it's a case of a recurrent respiratory infection in a healthy young woman.
My opinion, they don't.
And no disclosures. This is a 49-year-old woman with history of obesity, lipedema of the lower extremities, had COVID in September of 2023, but she has persistent cough, fatigue, and shortness of breath. Actually, it's important to know that actually these symptoms actually preceded her COVID symptoms, but everyone, the people who treated her kept saying that, oh, this is because of the COVID, but no one, gave importance to the fact that her symptoms preceded the COVID infection. Her chest X-ray was consistent, essentially normal, and so they told her that she has bronchitis. And of course, the treatment was antibiotics, steroids, inhalers, and she would improve temporarily, but again, the symptoms kept recurring, and ultimately she was referred to a pulmonologist, I think, in our hospital. And by the way, no history of cardiac or pulmonary illness. She's a healthy woman otherwise. A year before, she saw a specialist for liposuction of her legs because she had very big legs and she was also obese. And as he was about to do the liposuction or during liposuction, he told her that her veins were also not so good, and he actually did the treatment to open up her veins. That was his treatment, and he didn't give her much more details. This was actually a year before she started having all these symptoms. CT of the chest, of course, the pulmonologist ultimately did a CT of the chest. There's no evidence of acute or chronic pulmonary embolism. However, if you notice clearly, there is actually, I don't have a pointer here, but you can see a stent in the pulmonary artery, both right and left pulmonary artery, you can see stents there. And of course, on questioning her, she never had any pulmonary problems. She never remembered anybody putting anything on her pulmonary artery. So then, of course, now we go back to review the chest X-ray, and in the chest X-ray, one can see clearly there's a large stent in the right pulmonary artery and a large stent in the left pulmonary artery, or right and left branches of the main pulmonary artery. And the pulmonologist referred her to our CTS cardiac surgeon. To make a long story short, he then went ahead and did median sternotomy, cardiopulmonary bypass, removal of the covered stents from right and left pulmonary artery, and patient, of course, did well, went home on 4th post-op day. These are the covered stents taken from the right and left pulmonary artery. So in retrospect, obviously, what happened is that whoever did her liposuction and whoever said that he did some stents to her, he opened up her veins, he obviously put these covered stents in her iliac veins that are clearly undersized. And so in the covered vascular stents placed in both iliac veins were clearly undersized, resulting in them embolizing to right and left pulmonary arteries. It is likely that the presence of these foreign bodies evoked either an inflammatory response or microemboli, resulting in persistent respiratory illness for more than a year. Patient having COVID, of course, further complicated the picture, and everyone blamed COVID for her illness. So anyway, she did well, by the way. She has no more symptoms. Just to complete the discussion, non-thrombotic pulmonary embolism could be exogenous or endogenous, biologic or non-biologic. Biologic materials that cause pulmonary embolism are amniotic fluid, phantom embolism, septic emboli, tumor emboli, or any tissue fragment like piece of liver or something in trauma that we have seen. Non-biologic materials are, of course, mainly seen in orthopedic cases like cement, gas, iodinated contrast material, glue, radio tracers, catheter fragments, orthopedic drill bits, screws, etc. after spine surgery, and of course trauma, bullets, and in our vascular field or cardiac field, of course, stents, coils, and IVC filters. This is an example of a tumor emboli in the pulmonary artery, branch of the pulmonary artery. This is one from one of the journals. This is not our own case, by the way. So this is a chondrosarcoma embolizing into the, renal tumors are known to do this too. And this is a non-thrombotic pulmonary embolism. This is an embolization of acrylic cement to pulmonary arteries after vertebroplasty. Again, not our case. This is just from one of the case reports. So in vascular cardiology and interventional radiology fields, of course, many substances can end up in pulmonary arterial system, either in the large arteries or in the distal bed. These may be catheters and sheath fragments, guide wires, coils and glues, onyx, sclerosing agents, and foams. embolization of very large foreign bodies like the one that we showed today, that is exactly, entire covered stents is extremely rare, as just like the IVC filters, etc. Thank you for the presentation. So,
Thank you. Patty,
Well,
how do you size your venous stents, and who puts covered stents
well,
in
first
veins?
of all, putting a covered stent in a vein is pretty frowned upon. It doesn't work very well, and they thrombose very quickly. So I don't know what the size was and the miss size was.
I think the largest Viabon is what, 13?
13.
13, 14, yeah.
Boy,
I'm surprised it did not thrombose. But anyway, actually she went for liposuction, and these are the so-called plastic surgeons and many cosmetic surgeons who are getting into the vascular field nowadays.
well, I think she has 9 lives.
Yeah,
She
exactly.
just used one of them. No, but usually we would anticoagulate, and putting a covered stent in a vein is frowned upon, period.
Did you know they were covered stents before you took her to the OR?
No, we didn't know. We didn't know. Actually, by CT scan, in fact, the CT official reading was that there are 2 stents in the pulmonary artery, and they thought they put in for something else.
Did anybody talk to you or try to convince you to take those out with a snare?
No, I think these look too big to be taken by a snare. And secondly, we did not know they were covered stents or whatever stents. And our the other aspect, she was referred to our pulmonary, our cardiac surgeon, who actually has made a very good name on doing chronic pulmonary thromboendarterectomies for chronic pulmonary embolism,
Yeah.
etc.
I'd be worried about injuring the pulmonic valve, and that's easy to do and could be very dangerous. Yeah.
Did you ever find out the indication why the doctor placed two
Bilateral.
covered stents in the iliacs?
Yeah, no, that's very interesting. In fact, we tried to find out who was the surgeon, etc. It became a little more complex. We could not. But clearly, the story by the patient is she went for liposuction, and he did the liposuction and then just told her, incidentally, by the way, your veins were not so good, so we opened them up. Can you believe that? So Venki, is not our shit case, it's someone else's shit case.
Well, that was your shit moment, but okay then.
All right, our
Let's go to the
next case is Dr. Nelson Bernardo.